Few more family medicine stuff from the book. This is the book with the internal medicine Mayo Clinic book. I'm reading sexually transmitted urethritis. Maybe I'll put the image if you want, if you like. In case of addition to diagnostic testing, which empirical therapy is most effective? So the answer is ceftriaxone and doxycycline. Ceftriaxone and doxycycline, urethral discharge with burning or burning micturition HE urethra or typical symptoms. Neisseria gonorrhea, Neisseria gonorrhea, gram-negative intracellular Diplococcus diagnosis by molecular gene probe and gram staining culture injectable ceftriaxone first line therapy. Doxycycline and azithromycin for treatment. Chlamydia trachomatis 15-20% of patients with gonorrhea also have chlamydia. Non-gonococcal urethritis symptomatically indistinguishable from gonococcal variety, but much more frequent. Most common cause are chlamydia trachomatis. Common cause are chlamydia trachomatis 25% and 40%, and ureaplasma urealyticum. Other causes include mycoplasma genitalium, trichomonas vaginalis, herpes simplex virus. Sexual partners should be treated and intercourse avoided until treatment is completed. Okay. Next one we have is dissenting thoracic aortic aneurysm. The question is 54 women present with non-protective upper back discomfort, dysphagia, and thing is associated condition. Okay, pathology. Maybe we'll leave it and go to next question is methylglobin. Next case is methylglobinemia. Globulinemia due to dapsone overdose. Patient with human immunodeficiency virus as rash and associated with trimethorphan sulfamethoxazole used as a prophylaxis pneumocystic pneumonia. An alternate medication used is patient look 3 times the normal dose by mistake. Took 3 doses of he become dyspneic and headache and nausea and vomiting and skin discoloration show her here developed a normal hand shown contrast, which is alternative medication for trimethorphan sulfamethoxazole is D. 1D is dapsone. Okay, dapsone is alternate therapy. In addition to supplemental oxygen, which one of the following would be the most appropriate antidote? Most appropriate antidote is to C. Is methylene blue. In addition to supplemental oxygen, which one of the following is most appropriate antidote is methylene blue. This methylglobulinemia due to dapsone overdose. Want any the information? This is the chocolate blue, brown, or slate blue cyanosis. The color is mentioned as the image. I don't know if I will be able to put then all other things are pathology. Okay, leave it. Thank you for listening. Tuning. Opportunistic encephalitis, opportunistic infection, toxoplasmosis encephalitis caused by Toxoplasma gondii almost exclusively, and initial presentation involves what is the initial presentation? Excuse me. Yeah, we come to the headache, confusion, Focal neurological findings. Thank you for your patience. Couple of seconds behind the screen. Okay. So these many headache, confusion, focal neurological findings are quite a mouthful of stuff you got. And contrast computed tomography and shitty imaging of the brain usually shows a single or a multiple ring enhanced lesion. Empirical diagnosis confirmed by clinical and radiological improvement following treatment initiation. All right, radiological improvement because the single and pathology, single and multiple ring enhanced lesions might improve after these kind of therapy drugs. Lots of there. I have no time to give you this quick YouTube thing. We have a couple of few drugs I will just read out. Maybe Toxoplasmosis gondii encephalitis. We're talking about Toxoplasmosis gondii encephalitis. We'll just talk about CD4 count is more than 200 cells, that is tuberculosis and Kaposi sarcoma. Less than 200 is tuberculosis and Kaposi sarcoma, PCB, and disseminated histoplasmosis. Okay, these four fellows are there for less than CD4 200 and less than 100 Toxoplasma gondii encephalitis, cryptococcal meningitis, cryptosporidiosis, microsporidiosis. You will have less than 100 CD4 count. And DMAC, not getting it. CMV, I got this book I'm reading. CMV infection, PML, all got less than 50 CD4 count. And drugs are all very, very, very costly for HIV treatment and it's not available easily in the market. So be careful before you get acquired HIV and all these opportunistic infections. Thiamethoxam, sulfamethoxam, corticosteroids, lots of that. Will come in another video. This much information I got to give you. Thank you so much. Clarithromycin, azithromycin, dapsone is there. INH, yeah, fluconazole, carbicin, all those things are there. Thank you for tuning in.